Today's Coffee with Carrie, I really want to talk about the prioritization of the top practice areas that you should be thinking about in regards to video telehealth. Given the new billable codes coming down the legislature and just what makes sense from a patient experience, there's a few practice areas I really want to talk about today. Number one, chronic care. So anything around chronic health that needs proactive follow-up and communication, such as kidney, diabetes, dialysis, things like that, where the patient's at home and proactive communications and follow-up can prevent them from going into the ER. Especially with a lot of folks, I think over 30% of folks right now are doing dialysis at home. And just the follow-up that's required both from a doctor and nursing to see skins and infections and see how people are doing. Anything to proactively be able to manage and prevent them from being in the emergency room, whether it's flushing lines, whether it's looking at infections, things of that nature, can be very beneficial. Pre and post surgery follow-up. So whether it's an elective cosmetic surgery or it's a surgery done in an outpatient surgery in a hospital, the ability to check in with the patient, be able to video see them, see how they're doing, see their eyes, see their if there's a wound care, anything like that, be able to do that via video in the comfort of the patient's own home, post recovery, and as well as pre-surgical. So giving those instructions the night before, the day before, versus having to come in. As long as there's not like an evaluation needed and that can be done via video, is very beneficial. Pediatrics and OBGYN. So obviously moms and expecting moms that are pregnant, especially first-time moms, there's a lot of, going into the emergency room or emergency appointments. OBGYN, takes a lot of after-hours phone calls and, the ability to see someone and really see if they need to go into the emergency room or they can wait to come into the office tomorrow. Same with pediatrics is, having a sick kid, there's a lot of video telehealth going on, telemedicine, with moms, not wanting to get kids in the car and wake up other kids and go to the emergency room at night, and really seeing if it's something that's, non-emergent that can wait, that a prescription can be called in, or easing a mom's mind of that the kid's going to be okay and to do the following. There's a lot with breastfeeding and kind of the training around that, especially for women who are having hard issues with that, and being able to kind of see that through video and help out from that perspective. Mental health. Not every hospital, and especially in rural areas, have mental health folks on site or there 24/7. They'll be able to video into other locations or doctors and psychiatrists that are at home, especially in regards to suicide and preventing that and getting folks help and getting them into facilities. And then the last one I really want to talk about is addiction, substance abuse, and the opioid crisis. We did a great podcast on that a couple weeks ago that you can find on really how much that's affecting pretty much every county and every state in the United States, with pills, as well as that leading to heroin and the number of overdoses, and really getting that person right in the emergency room the option for help, and having that peer-to-peer video counseling that can really impact lives. And then once somebody does go to rehab, that's just the start of the journey. Once they get out, trying to prevent them from going into rehab 3, 4, 5 times, and having that peer-to-peer counseling, having them be able to reach out for NA sponsors and that ongoing support to not have them, back into an overdose situation, back into a relapse situation, and really giving that hand holding moving forward. And that's your today's Coffee with Carrie.